Hello and welcome to another episode of EduBiz here on the Serenity Resource Connector. Thank you for tuning in. Whether you're joining us live or you're watching the replay, it is always a pleasure to have you here. If this is your first time tuning in, a warm welcome to you. We're going to be talking about health and wellness plan this evening, and our guest is going to be sharing with us how we can live well affordably. And with no further delay, let me introduce to you Zygmunt Williams, Business Development Executive at FirstCare Medical Plan. Welcome to the Serenity Resource Connector space, Zygmunt.
Oh, thank you very much for having me. I'm very excited to be here.
Awesome. Really amazing.
Yes.
Let me just share with the viewers that we connected on LinkedIn
Yes.
mid-November of 2022. So Zygmunt was looking for the president of the Chamber of Commerce over there in Clarendon, and he found Winsome Witter in some article that was done. That was a Gleaner article. When I just assume office as a chamber president, is that the article that you came across? What's going on? Zygmunt appears to be frozen there. Just give him a little time to come back in. All right, you're back with us. Your microphone is muted now.
Yes, I'm back.
Awesome. Right. So I was asking you if it's a Gleaner article that you saw when I just assumed office as the president for the chamber.
Yes, it was. I was searching, and that's the first thing I found. And then I dug deeper and deeper until here we are.
All right. Awesome. So why am I sharing that? Because I know at times the younger folks and not so younger folks, you might be hesitant in reaching out to make that connection. Since we made the connection on LinkedIn, Zygmunt has been very present here on the Serenity Resource Connector. And in about December, about a little over a month after we connected, he wanted to find out how he could get on the Serenity Resource Connector. And here we are in February 2023. Yes. All right, because this series was not around at that time when Zygmunt reached out, but the opportunity was created. All right, Zygmunt, so we're here to talk about FirstCare, because I know a number of people saw that flyer and they're wondering what we're going to talk about, health and wellness plan. But live well affordably is actually the tagline for FirstCare, correct?
Yes, that's correct.
All right. And so you're going to share with us, what exactly is FirstCare Medical?
Well, FirstCare Medical is a company that really is for the people. As the slogan says, live well affordably. The goal is to really make private healthcare more accessible to our wonderful citizens of Jamaica. As you know, many persons don't have this access, and therefore, it has been a burden on the public system, the clinics and the hospitals. And we are here to alleviate that and to provide another option for persons who want to not be in a position where you have to wait hours, long hours for you to get some care. You're able to just go to your local doctor, your local pharmacy, and you're able to receive care and get back to your life.
Back to life, and that's what we want, because productivity is what's going to drive the economy.
Exactly.
Right. The entity is relatively new to Jamaica, but the plan itself isn't new, is it?
No, FirstCare has been around for a little over 13 years, going on 14. And, it has been in the Caribbean for a while and in the US. But most recently, we have launched in Jamaica officially on the 15th of September. So for those of our OG members, they know that we started out with just a few offerings. We had four main pillars that we offered, which was primary care, specialist care, labs and imaging, and prescriptions. But we've expanded since that short time into adding optical benefits, dental benefits, as well as actually doubled our coverage on the island. So we have grown in that short time since September, and only because of the support of our wonderful membership that we seek to continue to grow.
Awesome. We're going to share a little bit more on that. And for the Serenity Resource Connector community family from over there in Clarendon, Zygmunt is actually Clarendonian. So please make him feel welcome. So he's connecting with us from Clarendon. So all of my Clarendonian folks, right? So you shared this a little bit just now about the some of the different areas, the services that the plan covers. Is there
Yes.
any other area that's covered? Share with us the about the plan itself, because I know you have like different options,
Oh, yes, yes.
right? Just share with the viewers about the different options that you have available.
Right. So our health plan is unique. There's not really anything like it, as far as I understand here on the island right now. So we are offering three plans, and these plans, and I must say that we don't offer insurance plans, but we do offer health plans, right? So these plans that we have, they give you access to the healthcare providers that are in our network. So we're speaking about persons that we have already had partnerships with. So you might run into a situation where your personal physician may or may not be on there, but we do expand as time goes by, as we have just discussed. So First Care offers for the Jamaican market 6 main benefits. And as I said earlier, the GP visits, which are absolutely free. Yes. And we also offer additional benefits such as discounts or reduced costs that you pay when you see a specialist. Also, when you fill your prescriptions with pharmacies in our network, as well as labs, imaging centers, and also with Imperial Optical, we do have optical benefits as well as dental, right? So dental is a little bit more limited, as it is one of the newer benefits that we have been offering. So you're paying reduced costs for dental of 10 to 20% when you go there, optical 18% off your lens and your frames, and that is a significant discount, because you're talking about if your lens and frames are costing you somewhere about 60,000, 18% of that will more than cover your cost to see the ophthalmologist, right? And so most of the reduced costs that we're looking at are ranging between 10 to 30%, and it is just phenomenal, especially for the rates that we're talking about for the Jamaican plan, which is for 2,500 for an adult and 1,500 for a child. Now, in terms of the US plan, which is the second option, so there's a Jamaican plan, the US plan, and then there's also the First Care Plus, which is the Jamaican plan and the US plan together. And you get that at a discounted rate when you buy both, right? So for the US plan, it is a little bit more developed in some areas, because when you go to our physicians there in Florida that we have partnered with, you do pay a reduced cost of $60 per visit. And then we also have additional benefits such as a package that you can purchase the urine analysis and an EKG along with the visit for only 120 US, and also the executive physical, which is going to cost you only 550, right? On top of that, we have partnered with CVS Minute Clinics, and those are all over the US. And based on your location, you're able to quickly go to one of these clinics, and you're able to receive urgent care, and that's going to be at a really deep discount. So You're talking about the CVS mini clinics. In general, you're looking at a reduced cost of 40% already, right? Compared to seeing a primary care physician. And as a first care member, you also get an additional 15% off that cost. And then the big thing now, after you have gone to the doctor, say you're traveling and unfortunately something happened to you, and you went to the physician and he said, go and fill your prescriptions. We have partnered with 69,000, over 69,000 pharmacies in the US. So you're talking about CVS, you're talking about Walgreens, you're talking about Target and Publix and Rite Aid and all of these big brands that you might be familiar with through your travels. You're looking at up to 80% off your generic drugs and up to 40% off your on-brand drugs. So that in itself is a really, really major benefit. And, I've had persons that really were attracted to that portion because just the savings from that would have actually covered more than covered the plan for the time period based on what their treatment was. So the benefits are very wonderful. When you're looking at labs and imaging, and you're looking at blood work with Quest Diagnostics, as well as testing matters, unique imaging and diagnostic imaging. All of these guys that they've come together and they have partnered with us, and we're able to provide some seriously significant discounts for our members. And you're looking at, for example, a full body MRI costing you somewhere between 250 to 520 US dollars, right? And for those of you who have been in a position where you have been recommended to do an MRI, we know that to do a certain body part or a certain body part here or there can be quite costly. So the discounts are quite significant as a first care member. And on top of that, we do offer critical care, which is quite unique in the sense that for most critical care plans, you cannot purchase it after you are sick. So with the first care medical plan, if you have discovered that you have any of the three major medical issues that we cover, which would be for the cardiologist, for the orthopedic surgeon, or for cancer care, then you're able to get a special package after you have found out, if unfortunately you have found out that something is wrong with you in one of these areas, right? So there is an access fee that you pay that is a one-time access fee. So if you are already a FirstCare USA member, right? So this is only exclusive to FirstCare USA and FirstCare Plus members. And remember, FirstCare Plus is a combination of Jamaica and US, right? So if you discover that something is wrong with you in any of these areas, you're able to purchase the plan at that time. So you're able to access special discounts that would cover that entire treatment. And we're talking about from top to bottom, meaning as soon as you get there, there's someone that is going to, a concierge that will assist you in your onboarding process to begin your treatment. So you're talking about setting up appointments for your physician, for a second opinion, for the treatment, and so on. So all of these benefits are tied into this one-time fee. Right now, the fee is at $2,000 for these services. So, and that's US dollars. So the plan itself costs 3,000 Jamaican a month for an adult, 2,000 for a child. But these specific plans, you're looking at 2,000 each. And there's also a maternity plan where the access fee currently is at 600, and then you're able to go to either Florida or Louisiana to have your baby, right? So there are certain metrics that we would have to look at. So you'd have to reach out to us, and then we can look at your case, and then we can tell you what we can do, and you can know ahead of time what that cost would look like, and you're able to really budget and figure out how you're going to handle that, right? So the good thing about those plans too is that when you decide to take one of those plans and you don't have somewhere to stay in Florida, we do have a loyalty program that allows you to access significant discounts at your hotels and also for rentals. So you can actually find somewhere to stay and move around close to where you might be getting treatment or having your baby. So in terms of that entire aspect, you would be covered, right? So the only thing that we don't do is to put you on the plane and pay your plane fare and drive you to the, the facility, right? But we do offer services surrounding everything else. And as we continue to grow, we will improve on those services, which is always our goal, because we're a company that believes in continuous improvement, and we try to do that as rapidly as possible to meet the needs of our members. So that US plan, as I said, it will be 3,000 for an adult, 2,000 for a child, and for the first care plus, you're looking at 5,000 for an adult. So that's a combination of the Jamaican and the US, and for a child, you're looking at 3,000, and you receive all of those wonderful benefits. All right.
Quite quite a lot of benefits.
So quite a lot of benefits, yes.
Indeed. Right. Just to backtrack a little, you mentioned when you just started GP, just to clarify for the viewers,
Ah,
that's general practitioner.
oh, thank you very much.
All
Yes.
right. And you said the visits are free.
Yes, the visits are absolutely free.
So how often can I visit my GP, my general practitioner under the plan?
As often as you need to. And each
Okay. And
time
all of those are free.
it's free 99 each time.
Okay. Are there any limits or restriction or totally free?
It's totally free. There is no restriction. Well, in terms of restriction, it would probably be if it is that the card is being abused somehow. If somebody doesn't believe me that it is free and they want to go every day and try and see if it is free, right? Right, but I mean, if you're going to the doctor or going to the physician for a genuine complaint, of course it's free every time. If you go to the physician, right, and in Clarendon, everybody should know Dr. Reddy, and you go down to Dr. Reddy at Glenmuir um, Plaza, right, at Cy Medical. When you go to Dr. Reddy and he says to you, go and do an X-ray, go and do some blood work, and come back to me. If each time you're going to see him, it would have cost you. As a first care member, when you go each time, it's still free. So you don't have to really think again about that. If you have to go in for shots, or you have to, depending on whatever treatment you're going through, maybe you have wounds, or you have a wound and you have to stitch it up for you. Each time that you go, it is absolutely free. There's no additional cost to you. So what we have done at First Care is to take the first barrier of seeing a physician out of your mind. So you don't have to think about it being a problem again to go and see a physician. At least you will get a consultation and say, well, this and this might be wrong with you. It is important for you to do these tests so you can find out if there's a bigger issue, and so on and so forth. Because another big one, which is something that all Jamaican males need to really get on board with, the prostate exam. The prostate exam is absolutely free. We're talking about the breast exam, that's free. Let's say we're talking about being able to offer preventative care. So if you feel something, if you don't have to think about, man, we have to go find money for go doctor. No. You don't have to think about that, because it is already covered. So you're able to leave and to check out and find out things earlier, because you find out that a lot of persons sometimes they delay in seeing the physician, and it leads to a bigger problem that is harder to fix down the line, because the first thought is that boy, I don't have the money to pay, boy, I can't waste that the money. No, boy, find that money. People are concerned about the cost a lot of times. But with First Care, I am proud to say that we have eliminated that thought, right? We have eliminated it. So you don't have to worry about visiting the doctor. You don't have to worry about getting the prescriptions and so on, right? The first hurdle, you have already crossed it.
Okay. You mentioned prescription. I know we
Yes.
have that somewhere, but since you mentioned it, talk about the prescription. Is there a co-payment for the prescription? How is that treated?
All right. So one of our major pharmacies, right, that we have partnered with, Miss Powell there at Glenmuir Pharmacy, what she has done is allowed our members to pay a reduced cost when we go there. right? We as in, because I'm also a member, right? So
Okay,
when I
we'll
go to
explain
Dr.
that.
Reddy, right? When I go to Dr. Reddy, I can go to her and I'll pay a reduced cost of 15% on my prescriptions, right? And the good thing about my particular situation, and this is the case for a lot of people, is that you might still have another plan, right? I do have another plan, but I'm
Okay.
able to use both,
Ah,
right?
so
So
there's
now,
no limitation. So
and there's
even if you have a health
no
insurance plan, you can get the Medicare, the
exact.
first care.
Yes, you can get the first care. Don't let them sue
Okay.
me now. Please don't let them sue me.
No,
Right? Yeah, you can get the first care, not Medicare, right? You
we
can get
don't
the
have that
first
here. We don't do
care.
it.
But you can get the right with first care. There's no limit, so I can go there. Unfortunately, for some plans, for some insurance plans, not knocking insurance, of course, but for some plans, there's a limit on the amount of on your usage, right, in terms of prescriptions. So with first care, there's no limit. So for example, I've been to the doctor for some reason. This year has been a flu or cold year or sinus
Oh
year. I've been
yes,
there a few times, right? So when I go each time and I'm going to get my prescription, I don't have to worry that the card is going to run out, because I know for sure as a first care member that first 15% is not my problem, right? That's not
awesome.
something I have to think about. So then I'm able to apply the additional coverage on there and see major savings, which also, if you have that additional coverage, helps to keep that usage down, so you have it to use for a longer period if you're using both. So overall, it's just about saving and putting yourself and your family, your loved ones. Because remember, we did mention this in the first part, you can add anyone to the plan, right? So
Oh,
if you are a good Samaritan and there are a couple of young people in your community, and you're helping them through school and whatnot, and you want them to also have some health care, you can put them on that plan. Your niece, your nephew, because insurance is a bit restricted when it comes to some of those relationships,
right,
right? But sometimes aunties taking care of niece and so on. So for those kinds of situations, you're able to purchase a plan like this for a child for only 1,500, right? And
right,
that child is able to go to the physician for free. So if they every time they get the sniffles, every time there's a cough, you're able to go and you can begin that process to get them checked out and get something for them so they can get better quicker, right? So
right.
all of that is available with first care. So there is no age restriction, right? So, and every time I say no age restriction, people keep asking me, even if I'm 80, even if my mother 90, even my, right? God bless my grandmother passed recently. And she was 101,
So,
right?
wow,
And at 101, if she was still alive, she'd be on the planet here now, right?
indeed.
There is no limit to who you can add. So, um, I just want to say it one last time. There is no limit to who you can add. And that's a big plus for individuals, and it's also a plus for employees and some persons who want to maintain privacy as it relates to their health status, because we don't do any medical checks to become a member. It is so easy. You just go online, www.firstcarejamaica.com. You go the first page, you'll see the sign up button. You hit the sign up button and you fill out your form. It takes less than 5 minutes if you're computer savvy, right?
Right,
And you can add a dependent meaning just anybody you're sponsoring, whether it is an adult or a child, right? And we classify child from 0 to 17 and adults from 18 plus. So you can go on there and add that person. If you're going to pay by Visa or credit card, debit card or credit card, you're able to get the card instantly. So after you have processed the payment, there's an email, that two emails are sent to you, one with a receipt and one with the welcome email with the information to access the card. So you'll get a username that is generated by the system, and there's a link where you set your own password so you have personal access to the card,
okay,
right? So as soon as you do that, you do have access to the digital card. right? So you can access that through your browser, or you can access it through the First Care app, right?
Oh,
We are in app
all
world.
about app as well.
Yes, we're in app world. We're living in the now, right? So
Okay.
you can access your First Care card digitally, or you can print it. You can, some persons print and laminate it, and so on. We do have cards coming, right? And that is something that will be promoted on social media as in relation to the procedure, how to get it, and so on. But we do have physical cards coming, but you can, in the meantime, access. You go to the front desk, that already. You show the young lady, this is my
on,
healthcare
on your
card.
phone.
Um, yeah, I'm here to see the doctor. And they look at your number, you show them your ID, that's it, right? Even if you have the number, they punch in the number, you show them your ID, the information is going to populate, so just confirm it's you,
Awesome.
right? Right. So we're making it, and that really was birthed, the whole COVID situation.
Okay.
We're trying to go digital, so the company is really focused on staying in that digital world to make it accessible and easy for persons to be able to become a member on the plan. Also, outside of the individuals, excuse me,
Before you
outside,
get into the other
all right, all right,
persons who can become a member,
all
because
right.
yes, we want to make sure that you have enough time to go through that. Um, you did establish that there are a number of general practitioners, pharmacies, who else? Labs that are a part of the network,
Yes, yes, we do have a number of providers in the network.
right?
For persons who frequent Kingston, they would know about Winchester. That's a very popular one, as well as Apex. We also have Bay West in Montego Bay. We're talking about Burlington Medical in St. Anne, Bay Medical. We're looking at, excuse me, Dunrabin Medical, Health Plus, in carrying on our very own Psy Medical, Excel Medical, um, excuse me.
You have your water nearby.
Oh my, right? So we have all of these guys that are on board with us, and whether it is blood work that you need done, we're with Piker Labs and RK Labs, and we are also partnered with some wonderful excuse me, some wonderful persons here in relation to pharmacies, Kaylee's Pharmacy, as well as Faith Med Pharmacy. Edgewater Medical in Portmore is a big one, and we're also with Apex and Shancare there, and we're bringing on a host of other persons. Hopefully by the end of next week, or maybe the beginning of March, we can announce those. But we have some really big guys coming on. So we're talking about Spanish Town, Old Harbor, further penetration into Kingston, further penetration into Mandeville, right? So
Okay.
we'll be in Mandeville in very, very short order. I mean, that framework is already being built out. So it's just a process of verifying those persons. So on the website, you'll see a number of the providers that we have currently, right? But the updated ones, because of the speed at which they are being added, it's not on the website as yet. So what I can do is, for persons who are interested, they can reach out.
Right. And
Are we at
go.
that point as yet?
We
All
can
right,
share
so
that after, but
we
they
can share that afterward,
all
right?
Zygmunt's details in the description for this video, so you can find everything concerning him there. Email address, website, and telephone number, but he'll share it later on. All,
Right.
all right, not a problem. So the list of providers are there. I'm almost sure I saw a familiar face for the Kingston location. Is Dr. Dawes? Is he Winchester?
Dr. Dawes. I would have to
You
confirm that
verify?
one, but Winchester is on. I know Dr. Graham. The list is quite lengthy. I would have to go and look back and see who is on there. But
Okay.
for the providers there in Winchester, you're actually able to go on the website now, and you can see the drop down at who is at the
Okay.
locations that we have. Right. So we do have a lot of persons, and one of the things that we look for in providers, for persons who are interested in being a provider, there are certain parameters that they would have to meet. You'd have to be, you know, trained for a certain amount of years, and your facility has to be a particular way, because what we don't want is for our members to feel as though just because you're paying 2.5, you're going to be getting the worst of the worst. Or the idea is for Jamaicans to be living well affordably, so we want persons to have access to all of the best care that they can get for a very affordable cost. So we are very careful in the persons that we do get on board. Um, as much as we the excitement is there for us to add more persons and add more persons, we have to be careful about how we do it, because we want to maintain a certain standard, because we want a certain quality. When you are a first care member, you should feel proud to go in and to show your card, right? Because you're a VIP at our
Okay.
facilities. So that is the whole idea. So we want to make sure that we are really partnering with the correct people who have a reputation and a track record of success.
Beautiful. That sounds amazing. And for our live viewers, if you have questions, we want this to be engaging. So if you have questions that you'd love for Zygmunt to respond to live, feel free to put your question in the comments and we'll take them as we continue the discussion. All right, beautiful. Take your sip. Awesome. So, what's the process for obtaining referrals to specialists if needed? Is there a
Okay.
specific process?
Well, it's the same. The thing about our network is that everything really is designed to stay within the network. So everybody who has partnered with us, they would have that benefit, and also our members would have the benefit of knowing that they're going to the best of the best. So if you get a referral, for example, from your particular physician that you're visiting, the referral to see the specialist would have to be still in our network. So you can select from all the persons that you see there in the network, whichever facility you want to choose, and you're able to a request from your physician that you want to see this particular specialist or not. So it's very flexible in relation to how it can be used by our members. The only restriction you could say is that it has to be in the network. So persons have the ability to, if you, I don't know if you want to see somebody up by Bay West, maybe you want to go on the North Coast for some medical tourism, right? You go up there and you can go and you see the physician, and you can get your treatment and go and put your toes in the sand, right? So it's just up to you how you want to handle it. But the great thing about what we're doing now is that very soon in every parish um, you'll be able to access the suite of offerings that we currently have, and there are some very, 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 very exciting things that are coming on board. Some exciting developments, and it's just going to blow the membership away, because we are really looking at the best way to add value to persons who have not been getting any opportunity to benefit from this kind of thing, right? Because some persons, all they know is the clinic, and all they know is
Health
the
centers,
health centers and hospitals. So
hospital.
for persons who, and we know we have a lot of persons who they rely on remittances, their loved ones don't have to stress, right? Because they can pay a 20 US or 25 US, or whatever the conversion is, right? Roughly 20 US, and they're able to pay for a plan like this for their grandma or their aunt or whoever they're taking care of locally, right? So they don't have to think the person, somebody gets sick, boy, me need some money because it's already taken care of. So you don't have to think about healthcare, because we're paying something like 240 US a year, which is really peanuts over there, right? For this kind of coverage, it is fantastic, and even those persons that are there are able to benefit from the US plan as well. So, I mean, you have it is such a beautiful thing to me, because if I've decided I'm going to go and travel, I want to go to Florida, to go to Miami Beach and sip some mimosas or whatever it is that people drink, right? And I want to go to Miami Beach. I can do that knowing that I have coverage. I have the Jamaican plan. I can activate the US plan, right? Beforehand, before the billing cycle, and I'm able to have that coverage while I'm there, right? And I think that is beautiful. So when you're traveling, you don't have to worry that if something happens to me, I have to fork out a 150 US or a 200 US or something. You can at least be able to see a primary care physician. So the plan for an individual is very flexible, and especially for persons who do travel a lot, or are in executive management roles as well, that do have to travel for business. It is just beautiful.
Okay.
The plan, should I continue?
You continue. Just to
I have so much
clarify,
to say. Yes,
2,500, that's per month.
that's per month.
2,500 for adults and
Yes,
1,500 Jamaican
Jamaican.
for
Yes,
children 0 to 17 years.
yes.
All right, I'm learning.
All right, good, good, good.
But are there any additional cost or fees associated with the plan? Any
No,
enrollment or annual fees other than the monthly?
no, no additional fees. No additional fees. So
Oh,
it is very, we make it as easy as possible for you. We're not telling you that you need to pay 5,000 and you pay 3,000. There's nothing like that, right? There's no processing fee. There's nothing. All you need to do is go online and sign up. As I said, you can pay with a debit or credit card. You can pay through bank transfer. You can pay also through Bill Express. So if you want to pay cash quarterly or semi-annually, you can select that option and make those payments. And we do have other payment methods that are coming on board, and we that should be on this week, right? So we're expanding in every areas. Every area you can think about, we're looking to make it as convenient as possible for persons, especially those who, there are some persons who still don't want a bank account or don't have a bank account. So we have persons like that as well. I want to go through Bill Express. And so we try to facilitate each person, because we're not all at the same place, whether it
that's
be technologically or financially. So we try to reach our client base wherever they are, so that it can be easy for them to maneuver and to take on the plan and to use it, right? So we do take our time, and we like to provide quality customer service, right? And for those persons, if you're calling and you're not getting anybody, it's the phone, the phone, the phone, the phone. Just keep trying, right? The phone, right? So we are growing rapidly, and we're trying to keep up. We're expanding in every area. So we just want to serve persons as the best way we can, and help each other, or help Jamaicans to access this healthcare.
awesome. All right, you mentioned earlier that prescription, there are pharmacists on board who offer discounts on prescription.
Right.
Um, is there a list of medications that are covered?
No, there's no restriction on the medications.
Okay, so once it's prescribed medication, not over the counter.
Right, it's prescribed medication. Oh, yes, it has to be prescribed. Yes, thank
Okay.
you for that. Right, so it has to be prescribed. You can just go in there and pick up some Panadol and expect some discount there, right?
That's
So we really have to be clear on that one. So but there are so many other benefits to the plan, outside of individuals. I mean, for businesses, we do tailor plans depending on what the business is looking for, and that is something that we have been trying to really refine in relation to how we approach the business world. So we have been working with some persons that have given us the capabilities now to really tailor specific plans. So when you're looking at this kind of plan, and when I speak to groups, I speak to business people, we know that for a lot of us, or a lot of them, it can be quite difficult to take on a certain plan for the well-being of the staff, right?
Right.
Because there is a cost that is associated with it that sometimes does get a bit high as the years roll on. So, this is an option that can be used, right? Especially for persons who they need supplemental coverage, or persons that are at the entry level, or persons who already have coverage. But guess what? As I said earlier, there are persons in their circle that are not able to get coverage. They can cover them because they're getting covered already. So the plan is so flexible. It is something I believe that is an answer to one of the biggest issues that businesses are facing right now, turnover rate. The persons are losing staff like crazy, left, right, and center. And I believe that as long as you are taking care of your staff and they know that you have their best interest at heart, I believe that these persons, they will stick with you even a little longer than if they believe that you don't care at all. So if you look at a plan like FirstCare that you're able to activate in as little as 5 to 10 business days as a company, to me it's a no-brainer. I mean, for an individual to get activated, you're talking about instantly to about 3 days, depending 3 to 5 days, depending if you're doing a bank transfer from like a Victoria Mutual or something like that, or depending from what the bank to bank time is, right? But you're looking at 1 to 5 days for an individual, 5 to 10 days for a group. I mean, imagine this, right? You have a staff that they're coming and going, and you implement a plan like First Care, and you say to your staff members that, look, 2 weeks here with me, and one of the benefits is that either I cover your child or I cover you, for argument's sake, right? Just a scenario. The business owner is able to cover that child or cover that employee, and that to that employee, that is additional value, because while I'm working, I'm able to access the benefit. But let's say I forego accessing the benefit and pass it on to my child, because the flexibility to do that is there with First Care. So I know that while I'm working here, right, I'm able to, if my child gets a cold, I can run them to the doctor. I can take them from school and carry them to a doctor ready, and they can see a physician, right? In the mind of an employee, that is great value, and it is something that is going to help to reduce those attrition, that turnover rate. So when you're looking at, it depends on how you look at or how you view your employees and so on, but definitely these kinds of things, these solutions are there, and these are the things that we're out there doing for business people. And this is just one scenario, because there are different cases where persons are able to utilize the plan because it is so malleable, right? It is so flexible. You can maneuver it to whatever situation suits your company. So, we in every area, whether it be individual, whether it be business, First Care is here to really take the headache out of health coverage, right?
Awesome. And Janelle is reminding us about the GCT portion. So it's 2,500 plus GCT. I would
Yeah.
imagine with a network that's growing as fast as First Care, you would have to be taking care of that aspect of it. Thank you so much.
Yes, thank you very much. Yes,
Yes, fantastic. Teamwork makes the dream work.
can I tell you?
um,
Wonderful, wonderful. That's actually the country manager, so I just want to give her a shout out.
all
Right?
right.
Yes, man. She's doing a fantastic job.
Welcome, welcome. It's great to have you. All right. Or is there anything else on the employer side? Oh, I have a question for you. For
Sure.
self-employed individuals like myself and the many others,
Yes.
what are the benefits of having first care? Because it's not easy to get life insurance because you have to be under a particular plan in some areas. So first
Life
care is
insurance or
benefit.
health insurance?
Not life, health. Thank you for
Okay.
that. Health.
Okay. Okay. So for a self-employed person, it depends on how you want to do it, but it's just as I explained. If you want to
It's
take
like
on
an individual.
you can do it as an individual. You can you well yes, you'd have to do it as an individual. We could still do it under the company name. I would have to double check on that, but the procedure would be the same as I explained. So for example, for a group of persons, right? Um, the difference would be in how the onboarding is done, but it would still be either 5 to 10 days for groups. For a self-employed person, it will still be instant to the 5 days, depending on how they structure their payment. So it is very easy. It's not something for self-employed persons to really burst their brains about. If it is that you are in need of healthcare, which I believe everybody needs to have, everybody
Indeed.
needs to have it, because you might think that, well, you're going to have the money to do it, but at time somehow you get sick in a time where you probably don't have the money as you'd have it, or maybe you have the money for something else. But knowing that you have a health plan, it takes a whole lot of pressure off your head.
That's right. Um, in the event of individuals who are employed, they're on the group plan with their employer, but the relationship no longer there, the part companies. Um,
Yes.
can that individual continue with that plan, or will they have to take out an
No,
individual?
the person can continue with that plan. We just need to be notified, right? Because
Okay.
the payment will actually be coming from a different source, because it would be under the employer. So coming out, they'll have to do an individual plan, right? So
Okay.
they might have to go and re-register as an individual, but I mean the benefits would still continue as they were,
Okay.
right? So from that date or whenever they sign up as an individual going forward, that's it would just work the same. So it's not something that they have to really consider in relation to moving over, right? So they can take that same number with them, I believe. I'd have to double check that, but you can take that same number with you and keep going, right? So it's not anything that, let's trust me, we make it as easy as ABC, right? So it's not something that you have to be jumping through hoops. You don't have to come with a letter, sign and stamp from the JP, and two pastors signing a letter, and something from the police or a judge, right? You just come, right? And you speak to us, right? We're not monsters. We're not going to bite your head off. And you just tell us what your situation is. And just as we do with business owners, we try to work with our clients as best as possible, because things do happen in life that you do not expect. And we do our best to be as understanding as possible, and to work out ways in which we can maintain the relationships that we already have, right? So First Care is the company that you should think about when you're thinking about ease, when you're thinking about customer service, when you're thinking about quality health care, and that's quality primary care. So we just want everyone that is watching and everyone who's going to watch afterward to know that it is not just about making money, right? It is not just about making money. There are people out there, and there are so many people that are suffering. I don't know how many people take the time to really go through the hospitals, and people are there waiting when it's dark, still dark out, and they're in the line waiting for to get their prescription, right, filled. I mean, it's not a nice thing to see that somebody's mother, that somebody's father, somebody's child, and just to know that there is this option that is available, that is it cost one of my colleagues said that it's the cost of a pizza, right? It's the cost of a pizza. And to know that you're taking that stress off of your head, it is to me, it is very priceless. It is very priceless. So come on, don't wait. Come to
All
first. We're here for you.
all right. All right. Awesome. So other than going over to Montego Bay to dip your feet in the sand and
Yeah.
enjoy, are there any wellness programs or resources available to members of the plan to support health
Um,
and wellness?
in terms of resources, we do share information through our social media um, to educate our client base about different health, whatever the breast cancer month, this. We do share information, and I do believe tips on there. Outside of that, we do offer services to the business community that are clients of ours. So we do programs where we go into the groups. If you're having a health and wellness day and the company is our partner, right? Then we go in and we'll carry a nurse in, and we'll educate the staff on a particular topic for that day, do your testing depending on what the focus would be, because one of the benefits of the plan, as I mentioned earlier, it is digital. Therefore, you're able to get real-time updates on the usage. So just a general overview of what, maybe pharmacy, how many visits are this, how many visits are that. So you're able to really look at it and to make an educated decision on a health and wellness program in real time for your staff. And then we will come in and do our work along with your program by providing these kinds of benefits to that organization. But that would be it in relation to the other benefits that we provide in relation to health and wellness. And outside of that, First Care is a company that believes in giving back. And we do sponsor. We just gave a scholarship recently, and and that is something that is ingrained in the corporate culture, and it has been going on over the entire time that First Care has existed. So the founders and the directors really do believe in education and helping the youth to strive for better and to access better opportunities that wouldn't be available to them because of the lack of resources. So First Care is, as I said, is not just about making money. We're here to make an impact on the island, in the country, and we will be able to do that with you, our wonderful members and clients. And trust me, in about a year, maybe two, you will be amazed at the impact that we'll be making on this beautiful island of Jamaica.
In, indeed. Amazing. Good, really great stuff, Zygmunt. Is there a group rate for
Yes,
this?
yes, there are group rates that would have to be looked at on a case by case
I
basis.
would imagine, yes.
Right. So we would have to look at, but we are, as I said, flexible. As long as it makes sense, it is something that we're willing to look at. So there's no hard and fast, or there's no limitation on any kind of conversation. Everything we can have a conversation. So
All right.
it's just for the business community to reach out to us, and we can sit at the table and have a discussion.
All right. This is a good point at which you share your contact details.
All
On
right.
screen, right. It's in the description, but go ahead and
Okay.
share on screen so for those who
Okay.
didn't write it down.
All right. So my phone number is 876-832-5617, and my email address is zwilliams at firstcarejamaica.com. And you're also able to get additional contact information for the office on our website at www.firstcarejamaica.com. where there's a wonderful support team there as well. They're just phenomenal. So you can reach out to me, and if you so desire, you can also reach out to the office for further information.
Awesome. And I'm sure there are some community groups that might want to reach out to you so you can do some immediate presentation to their groups.
Sure,
So
yes.
feel sure to do that. The neighborhood watch groups, community development committee, development area committees. Zygmunt
Mhm.
is open to doing more immediate discussions with your groups. So feel free to reach out to him and they'll be happy to have that one-on-one discussion to see how best they can tailor a package just for your group. All right. So you can help those in your community. And remember, one of the special things about this is that you don't have to be related by blood, just
Mhm.
by love.
Can I tell you? Yes.
Just
All
by
love belongs
love.
to
So
the
you
welcome.
can
Yes.
you can actually sponsor someone in terms of
Yes.
getting them on. So that's a very, very fantastic,
Yes. I believe
a
so
big
too.
win, I think, for me. Very informative indeed.
Yes, yes, yes. It was a pleasure to be here. I mean, there's so much more that I didn't get to share in relation to ways in which the plan can be utilized, especially for the business community. So, don't be hesitant and think that there isn't more. There is more. And
All
for
right.
those who are individuals, we do have some wonderful things coming.
All right. Zygmunt, that sounds like a subtle way of having me invite you back on.
Course, of course, of course. Let me tell you, in a few months from now, its first year is going to be in.
Some new things, right?
Yes,
Don't.
it's going to be a brand new. You're going to have me again.
All right, definitely. We're making some shifts on the program, but we'll definitely have room for that. All right, so
All
here
right,
it is. We will be in touch.
all
All
right.
right,
Thank you
so
very much.
here it is. Take note of the name. So when you see, I hear that name, you know that this uh, is this Lane Robinson. I hope I'm not butchering your name. All right, awesome. Thank you, Sir Campbell. Great to have you. Thank you so much. All right. So for those who are on, we have created a WhatsApp community because a number of persons have been asking for some time to get some direct messages to let them know when we're going live. So there's a WhatsApp community. So look on the YouTube page for the link tree, and there's a link there for you to connect to the WhatsApp community so you can stay informed and never miss anything that goes on here in the Serenity Resource Connector space. And be sure to check out the community link on the YouTube page. There's a lot that's shared there from different entities, the Jamaica Business Development Commission, Companies Office, if you're in business. That's another area that I focus on in terms of providing support for business registration and compliance matters so that you can stay compliant so you can access the awesome resources that are available through the different business support entities. Zygmunt, it has been a pleasure sharing virtual space with you.
Yes, truly, I appreciate it. It was good to
Awesome.
be here.
Awesome. And kudos on reaching out and staying connected.
Yes, 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 yes,
This is
yes.
a demonstration of what it means to really network. And I trust that more of our young people or people in general will understand the importance of this, right? Zygmunt and I have never met in person. I know the name because this name is just so unique. I would have seen the name when I was in the cable
Mhm.
industry.
Yes, 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 yes,
Right.
yes.
So when I saw the name come up on LinkedIn and I saw Mape and Clarendon, did not hesitate in connecting.
Ah,
Zygmunt,
wonderful.
congratulations. I know that you're going to go very far. And I just want to commend you on the effort that you're putting into doing something that I think is really worthwhile and meaningful for our Jamaicans. Because a
Yes.
part of the Clarendon sustainable development plan is that whole aspect of health and wellness. So you need to stay tuned so you can hear more about that and see
Of
how
course.
FirstCare can help Clarendon to get that right. All right. Thank you so
Yes.
much
Thank
again
you,
for
dear.
being here. Those who were able to join us live or watch the replay, thank you for tuning in. Remember to share. And if you have not yet subscribed, please subscribe, set your notification bell, leave a comment, like if you find this informative so others can locate the video and continue to get the awesome information that was shared here. Thanks again, Zygmunt and the FirstCare team. Kudos on what you're doing for Jamaica. All right. Have a great night.
Yes, good night.